Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. We are joined today by Dr. Natalie LaDuke, one of our outstanding school psychology faculty members. Welcome, Dr. LaDuke.
Thank you so much for having me. Hi, Dr. Garrison.
So, tell us a little bit about what spurred you on or inspired you to join the field of school psychology.
Yeah, that is a great question. I have been interested in psychology for as long as I can remember. I've had a particular interest in working with individuals with disabilities. So, when I
Hmm?
was in high school, as far back as high school, I was very involved in the Special Olympics.
Uh,
So, I was one of the student coaches and I absolutely loved being involved in Special Olympics. So for a long time, I thought maybe I wanted to be a teacher, but I
mhm.
had this feeling in the back of my mind that I couldn't shake that I loved psychology. So I thought maybe I could be a AP psychology teacher. I didn't
Yeah.
know how to bring the two together. And when I was in college, I was talking to a friend who was a teacher, and I said, I love teaching, but I love psychology. And they said, have you ever heard of school psychology? And I hadn't. And I went down a rabbit hole and I started researching school psychology. And I found that there was a field that
Mhm.
um, brought together schools and education and working with kids with disabilities. And you got to be a psychologist and promote mental health. And I knew it was perfect for me,
That
and it
was it.
has been a perfect career for me. And now it's kind of funny because I'm faculty at the Chicago School and I get to
Yeah.
be a teacher. So it's kind of
That's
been full
awesome. You got
circle.
everything you wanted.
I
The
know,
perfect
I know.
career.
I have
I
to
love
pinch
it.
myself sometimes.
Kind of staying on that teaching part, what are some of the aspects of being a faculty member and doing classroom instruction that you enjoy the most?
Yeah, yeah, that's so for me, the classes that I am a course lead for here at the Chicago School are neurodiversity
Mhm.
and dissertation seminar. So in neurodiversity, I get to teach the students about different diagnoses that they might see as school psychologists that are in the DSM, the book that we
Mhm.
use to diagnose different disorders. But I get to teach that class in a really neuro-affirming way. So that is something that has become so important to me is that
Yeah.
not that we ignore problems that children face or um definitely we don't want to shy away from treatment and
Right.
intervention, but I'm able to train school psychologists to go out into the field and see the whole kid,
Right.
including their strengths.
Yeah.
And so bringing that to neurodiversity has meant so much to me. And I think it
Yeah.
really resonates with the students as well.
Yeah. I love that approach because I think, from a clinical perspective, whether it's in school psychology or clinical psychology or forensic psychology, it can be a little too easy to focus on the deficits, right?
Yeah.
The boxes you've got to check for the diagnostic criteria,
Yep.
but there's a whole person there and they've got
Hmm.
strengths, they're beautiful things about them. And I think helping students understand kind of the whole person
Hmm.
and the full package that they bring to whatever situation they're in to their life is really awesome.
Yeah. And I think that when we leverage those strengths with the
Yeah,
kids that we're working with, our interventions are more successful. The
absolutely.
families like us more,
Yeah,
the team
right.
is more, it just, everything works a little bit better when we pay attention to what the kid is really good at and see them
Yeah,
for, like you said, the whole picture.
yeah.
The other thing I would say about my teaching is that my other really area of passion is dissertation, helping
Mhm.
students complete their dissertations. Initially, I was hesitant to get involved in that class, and now I just love it because you get to work with students who are at the very beginning stages of maybe just a little idea that they're kind of exploring,
Yeah.
and watch them go to the point of really achieving this level of confidence as a doctoral practitioner and researcher, which
Yeah.
has been so fun for me as well.
Yeah, I've always enjoyed the dissertation process as well. You know, like you said, they come in with an idea. Sometimes it's not well formed, but it feels like something that they're passionate about, and they still have a lot of questions, and they go through this kind of rapid growth and development process in that area, and to see them present with so much confidence and competence and
Mhm.
expertise at their final proposals, it's just awesome to watch.
It is. It is. It's real. I always cry. It's it's really nice to be a part of.
Yeah. Um, so within the school psych program, you know, you've talked about some of the areas that you focus on, and there's a lot of things that students learn, a lot of skills and competencies that they develop over the course of the program. But as you think back about the students you've worked with and
Mhm.
your history in the program, what is one skill that you hope every single student comes away from the program with?
Mm. Um, this is really particularly important to me. It sort of relates to the research that I'm doing right now. I have a
Yeah.
very strong interest in resilience and
Okay.
what keeps kids resilient, what makes resilient practitioners. And for the last 2 years, I've been researching burnout because we, in the field of school psychology, we are facing a major shortage. We need more
Yeah.
school psychologists, as many as we can get. And we want to keep people in the field. We want them to
Yeah.
be engaged and happy and doing the and having the skills to really hang in there through the tough times and get their cup filled from the
Yeah.
job. So, what I have found through my research on resilience is that there are a lot of skills that you can practice to make you a more resilient clinician. And I
Hmm.
think at the Chicago School, in our program, we do such a good job preparing you with all of the assessment and counseling and therapeutic and consultation skills that you need. And I'm so glad that we are focusing on what helps you be a resilient clinician
Yeah.
and take care of yourself in
Yeah.
this role. And I think that makes us unique as a program because we are focused on um, making sure not only that our students are prepared, that comes at a baseline. Our supervisors consistently tell us how prepared our students are. I want our students to feel prepared to stay in this field for the next
Yeah.
30, 35 years.
Yeah. Yeah. I think that self-care piece is so important. Certainly something I wish I'd gotten a little more of in my grad program.
Yeah.
So it's awesome that the school psych faculty help their students focus on that.
Yeah, absolutely. I think it's great as well.
So as students are looking at the possibility of going into the field, they're looking at different programs and trying to decide which program to choose. Do you have some
Mhm.
advice for students as they kind of go through that research and consideration process?
Yeah, yeah. One of the pieces of advice that I would give all students is make sure you really pay attention to school psychology because it is a great field and you get to work as part of a team. You get to work with kids where they are, where they go every single
Yeah.
day. They spend 8 hours a day, 5 days a week in schools. So if
Yeah.
you really want to work with kids, that's where they are. And then the other really amazing thing is that through our PsyD program at the Chicago School, if you complete your PsyD and do one additional year of postdoc training, you can take the exam to become clinically licensed as well. So
Yeah.
that's what I did. I'm a dually licensed school psychologist and clinical psychologist. And
Yeah.
I feel that our program and the degree of school psychology provides students with a launching pad that can just open so many doors for them in the world of
Yeah.
both school and clinical psychology.
Yeah, I completely agree. I'm dually licensed as well. I'm a
Mhm.
licensed school psychologist and a licensed psychologist, and it
Mhm.
is a powerful combo for sure.
Yeah, I find, Dr. Garrison, you can tell me if you agree that we can speak both languages. We know
Yes.
all those funky acronyms that we hear in
Yes,
schools like
right.
IEP, MDR,
Yeah.
and we know all of the clinical terms too. So we're very a valuable career, I would say.
100% agree.
Yeah.
So, kind of staying on the program selection piece for just one more question.
hmm
Um, why do you think the Chicago School is a good place for students to come and study?
Mm. Something that I think makes the Chicago school very appealing to a lot of students is that we are focused on creating really solid practitioners.
Mhm.
And we many of the faculty do research and we're involved in research, but I think at the core, most of us are practitioners. We've all practiced, we've been in the field, we've done
Yeah,
the work, and we are really focused on training people to be really solid practitioners. So I think that's what makes us special is that we all very much have our hands in the field.
yeah,
And then I would say that part of where we're located as well, we are not only housed in an amazing urban area like Chicago, so we've got so many incredible training opportunities just through the proximity of being in a big city. We're also housed in this professional school.
yeah,
So we have a clinical program, we've got a forensic program, we've got ABA. There's so many opportunities for collaboration and learning
yeah.
that I think the Chicago school just offers so many unique opportunities to students.
Yeah. On the practitioner front, I've told this story many times, but I'll tell it again here. I did my doctoral degree in a very traditional kind of R1 scientist practitioner program.
Same. hmm
And on internship, I did my pre-doctoral internship in Chicago, and I had an opportunity at my internship to work with some practicum students from the Chicago school.
Mm,
And I was blown away by their
yeah,
level of preparedness and actually felt like, gosh, I might need to brush up on some of my
I
skills
know.
to make sure I can hang with these folks. I do. I think that's one of the things that we do really well. A lot of people talk about a practitioner focus, but I think we really deliver on it in a
hmm
pretty unique and special way.
I would agree. So before I was faculty, I was working in training and I spoke to supervisors all the time, every single week. And supervisors really shared with me that our students are some of the most prepared when it
Yeah,
comes to assessment, counseling. And I think that's really important to us as faculty to make sure that we bring what's really happening out in the field and
yeah,
balance it with best practice
yeah,
and the gold
absolutely.
standard. hmm
Well, Dr. LaDuke, I've enjoyed my time with you today. Thank you so much for joining us.
Of course. Thank you for having me.